Uterine tumors. Uterine tumors, which are usually fluid-filled, occur in tissues in any part of the body. The appearance of tumors in or on a woman's uterus can be divided into two main categories related to disease and tumors on any part of the uterus that develops as part of the menstrual cycle. 1. Cystic fibrosis is a disease caused by various diseases that cause problems such as abnormal cell growth and become malignant tumors or cancer. 2. Uterine cysts. Every month, a normal egg in the sac is released from the ovary. If the sac does not open, the egg will continue to grow into a cyst. The lump of the ovary may ejaculate on its own within 3 months. In some cases, the sac does not release an egg but does not shrink, and then the fluid or blood formed inside it remains a lump on the ovary and it disappears on its own. When an ovarian tumor is first detected, the exact chemical type cannot be determined unless the symptoms are obvious, and the patient usually needs to see a doctor for 2 to 3 months for observation. If the cyst disappears, no further action is needed. Symptoms of uterine cysts. Most uterine cysts do not cause any symptoms, although as they progress to cancer, many women are unaware that they have the disease. But the symptoms may be present depending on the type of tumor. For example, patients with chocolate cysts may experience chronic hip pain during the menstrual cycle. If you have normal pain or discomfort in your abdomen or pelvis, consult your doctor for advice and treatment. How can cysts affect pregnancy? The thin chocolate present on the ovary can prevent the ovary from forming an egg for fertilization. A lump caused by an abnormal lump in the uterus can also be associated with infertility, as an abnormal lump in the uterus can affect the function of the ovaries. The uterus or womb makes it difficult for women. Every month, the lining of the uterus is made up of natural hormones to prepare the egg. If pregnancy does not occur, this is shed from the body in stages. Abnormal uterine rupture is a condition in which the inner lining of the uterus grows elsewhere. It thickens and bleeds normally during menstruation but cannot leave the body. This can cause inflammation and the formation of scar tissue and pustules that can block the fallopian tubes, which keep eggs and semen from coming into contact. Abnormal uterine rupture can also lead to involvement, causing tissue damage and deformity. This affects the function of the reproductive organs and in fact it can lead to infertility. Treatment. Treatment for ovarian surgery usually involves medication and surgery. Doctors may prescribe birth control pills to slow the growth of cysts, but this is not suitable for patients who want to give birth. Surgery may be recommended to remove the cyst, which can be done through a melatonin. The cyst can be removed for testing to determine if it is cancerous or abnormal. With ultrasound, the surgeon removes the lump through small incisions so that the patient has less pain and heals faster. In addition, the evolution of the ultrasound increases the chances of a natural pregnancy. Treatment for uterine cysts depends on the type of cyst and on the needs of the patient. If you are trying to conceive, your doctor will prescribe the right treatment that does not interfere with your ability to conceive.